McCuistion, for over 28 years talking about things that matter with people who care. Production of McCuistion is made possible in part by individual viewers, supporters of the Foundation for Responsible Television, the University of Texas at Dallas, creating the future.
Well, hello, I'm Dennis McCuistion, and you can see that we are still operating remotely via Zoom, but we have an incredible program talking about some mental health issues, in particular suicide, and how the economy and all these economic effects are bearing on this issue. And joining me, as always, is my co-host, Jim Falk. He is the CEO of the World Affairs Council of Dallas-Fort Worth. Jim, welcome back to the program.
Always good to be with you.
Thank you. And the two people who are joining us today, Andy Keller is the president and CEO. He's a psychologist, and that particular organization is the Meadows Mental Health Policy Institute. He's got all kinds of experience in behavioral health policy. He's a recognized leader in health and human services integration, behavioral health financing, and implementation of empirically supported practices for adults and children. You're going to hear about one of their latest pieces of survey information, which will be very vital to us. So Andy, welcome to the program.
Great to be here.
Yep, thank you. Also joining us, returning to the program for the second or third time, is Vanita Halliburton, co-founder and executive chairman of the Halliburton Foundation. She's a frequent speaker on youth mental health and suicide prevention in schools, at professional conferences, and throughout the North Texas community. She speaks, as you might imagine, from the heart about her son's battle with depression and bipolar disease, his unfortunate suicide at age 19, and the need for a collaborative and comprehensive approach to mental health education and suicide prevention here in our viewing area. So Vanita, welcome back to the program.
Thank you.
You and Andy and other folks in this space have focused on this issue of suicide. So let's start with that. Give us where we are, so to speak, and what you think the impact has been so far and is likely to be because of this economic situation and all this stay at home and social distancing.
Well, I'll say this right up front. It's too soon to tell what the impact in terms of increased suicide rates are. I think that people are dealing more with very high anxiety, symptoms of depression. They're dealing with grief and loss over things like loss of a job or uncertainty over the future, just everything the crisis has brought in terms of losses for all ages, graduations, weddings, the inability to be with people very much or be out and do the things we used to enjoy very much. Those are all very real losses that are feeding this anxiety and worsening depression in a lot of people. Even people who've never had these symptoms before, no one's really immune to feeling that way. We do know from talking, not from any numbers yet, but from talking with hospitals and other mental health professionals, that hospital admissions and emergency room admissions for suicide attempts, that's really not increasing right now. Maybe people are afraid to go to the hospital. I think it's more that we're going to have to wait for those numbers to really come in to see what that's going to look like.
Well, you mentioned something very important there. There is a growing body of evidence that more and more people are dying at home, apparently some because they're afraid to go to the hospital. Some of them may be suicides, but the data that you're going to be talking about in a minute is, I think, based on 2018. But what's happening to the suicide rate the last couple of years in 2019 and 2020?
Well, it has risen pretty much among all ages. We've seen especially rises in the 14 to 25-year-old range. It's the second leading cause of death in the U.S. compared to suicide being the 10th leading cause of death among all age groups in America. But we've seen a rise in youth suicides. It's trending younger. We're seeing more as young as 9 or 10 years old. And you know, the CDC tells us that the two very important protective factors against suicide are a sense of connection, a sense of belonging, and connecting with other people, connecting with a job, connecting with all these things. And we're losing all that right now. That's eroding under our feet. So that connectedness makes people, lack of that is making people more susceptible to feeling that despair and feeling suicidal. And the other thing is coping skills. Resiliency, the ability to problem solve and cope through hard times. That's another strong protective factor that we are probably sorely missing. A lot of people are lacking in that right now.
Vanita, that's quite startling that you're saying that you're seeing such an increase with younger children even before we entered this situation with COVID-19. What are the root causes?
I think it's a lot of things. Children these days are exposed to so much more media-wise, world-wise than we were as children. They're growing up faster. They're having grown-up problems, and that coupled with the fact that we have an awful lot of helicopter parenting still going on, and that is the opposite of building resiliency. So when these kids hit a hard place in the road, they are ill-equipped to deal with problems on their own and to get through a hard time. So the kind of despair and the loss of connection and all the things we're talking about with the current circumstances is really feeding, is when it comes up against lack of resiliency, that's a very dangerous combination.
And when you talk about helicopter parenting, right now we're all in the same airport, same heliport. We've been
That's
that way.
exactly right. That's exactly
Andy,
right.
I wanted to ask you to just take a moment and help us know more about your institute, and because I was so impressed with the report, which we'll get to in a second. Your institute is very nimble, and tell us more about it then.
So our institute, we've been around since 2013, and we're a mental health policy research institute. We were founded by the Meadows Foundation, and we bear their name very proudly, but we're a private nonprofit. And, our goal is to understand the kind of issues that Vanita was talking about, and to try to figure out what do we do about that so that Texans, when they run into problems like depression or suicidal thoughts, have the best available supports in the community and the best available supports available at church and the best available supports when they need to at the doctor, so they can get better and get back and we don't lose them to these treatable diseases.
So your focus is on the greater Dallas area or Texas, or?
So we focus primarily on the state of Texas. I think increasingly we're working on things nationally because a lot of these trends, for example, how hard it is for people to find a mental health therapist when they need to, which, Vanita's organization has done a great job here in North Texas, making that, helping us navigate that. But that's a problem across this country. I mean, most of us on our insurance, if we go to try to find a cardiologist, we're going to find the first one on that list. If we try to find a psychiatrist, we're going to have to call 10 or 15 before we can get in, if we find one. So, and that's if we live in an urban place like Dallas. So we're really looking at this, these are national issues, but our primary focus is on the state of Texas. So we are basically have offices in Dallas, Austin, San Antonio, and Houston, and then a couple people live in Amarillo.
Well, let's talk now more about the report that recently came out.
You bet. So, I think what you all said at the beginning is we don't know. I've never lived through a pandemic before, and even when we've had pandemics, they didn't do this. We didn't shut down the world to try to stop them, which we needed to do. We didn't know what was going to happen. So we wanted to understand that. We knew in early March that this was beginning to be something big, and so we started thinking, okay, what should we look at? And all those issues Vanita listed all impact what happens to folks with mental illness. And while suicide is one important thing, there's other things, addiction, child abuse, domestic violence, trauma. A lot of things can happen. So we're trying to study all those things, and then we have to try to disentangle them. And I think too, whenever we study these issues, you got to keep in mind it's not just the bad thing that happens that might trigger something. It's also what is the response. And one thing we know in the literature on suicide is that the response of people when someone says that they're feeling suicidal can make all the difference between whether that person feels cared for and helped or whether that person feels like there isn't anyone who cares. So all of those factors. So we say, okay, what is the one that we can kind of wrap our arms around? And the one that has the clearest impact is economic conditions. So unemployment, if we look back at that, rates and unemployment correlate very strongly with changes in deaths from suicide, deaths from overdose, addiction, what we sometimes call diseases of despair. So we looked at that, and as Vanita said, they're at record levels. I mean, as she said, among young adults and adolescents. It's the second leading cause of death. It's the third leading cause of premature death. So like death before your 80s. It's the third leading cause behind cancer and heart disease. So we knew we were starting with high rates, but what would happen if things got worse? So what we learned was there's a very strong correlation. It's actually stronger in Texas than in any other state between effects on the economy and deaths from suicide. So, you know, we projected basically for every 5% increase we're going to have in the suicide rate or in unemployment. So, you know, started out about 3.5% nationally. If it goes up to 8.5% nationally, we'd be looking in Texas at about 300 additional people dying from suicide. So just almost a 10% increase. Put that in context, we've lost about 800 people so far, probably trending over the next few weeks over 1,000, maybe up to 1,500 from COVID, and you know may lose more over time. But it's certainly another really important health issue we need to be looking at the same time that we're looking at COVID.
Did I understand you correctly? You said that the correlation is greater in Texas?
Yeah.
Why?
Well, we don't know. I mean, we can speculate. I mean, there's a couple things that make that association. Low unemployment rates, baseline unemployment rates tend to be associated with a stronger effect, perhaps because people, it's more of a shock. You know, if you're in a place where you're kind of used to chronic unemployment, maybe it's not as much of an outlier. I mean, you know, suicide is complicated. About 75% of deaths from suicide are related to depression. But, you know, a change in circumstances, an extreme thing that happens can cause a person to feel that, you know, life just isn't worth living anymore. So, yeah, I think it's maybe the shock factor, but you know, that's speculation.
And of course, you could take the instance of what's happened in the Permian, Midland, Odessa area, and parts of New Mexico, where people were eating lobster at lunch and suddenly at a food bank the next day, losing their job so quickly.
Yeah, that's why hope is so important. And that's why the response that we give to people to say, hey, you know, this is not a forever thing. Even if you're having trouble sleeping, haunted by these thoughts, we can help you. We have help. It can make the difference. And frankly, almost every case, not every case, but almost every case. And I think it's that hope equation.
Vanita, you are, and both of you are obviously nonprofits, and the impact on funding for nonprofits. We've got, you know, coming up, we've had, I should say, recently a National Giving Day, and that may help. But with the funding issues because of the economy and the increasing need, it seems to me like there's a real pull from both sides. Am I missing something there?
Not at all. We know, and we're very respectful of the fact that there are basic human needs that nonprofits serving those that really are going to need a lot of help in that. But the mental health and the things that we can do to keep people here on the planet are also critical. And so the work that Meadows Mental Health Policy Institute is doing and other nonprofits focused on mental health and suicide prevention, people are going to need their mental health to re-enter. You know, we feel like the worst is yet to come. A lot of mental health experts are saying that we're in survival mode right now, and we kind of are kind of up for barreling through this. But when it comes back to re-employment, as people try to re-enter the workforce and everything, the new stress that comes around not having childcare, if you have school-age children in the home, or the childcare you had is not available, it goes on, and that's going to be kind of like a PTSD effect. The trauma and anxiety that can come farther down the road here in the next months is what we're gearing up for, trying to support people in terms of taking care of their mental and emotional health.
Yeah, when you talk about their mental and emotional health of trying to get back to work, they've got this thing of, first of all, is everyone, let's say, physically equipped to get back to work? Does their anxiety level allow them to go back to work, given the fact that they may be at risk? How do you help them in dealing with those kind of mental health issues?
Dealing with those kinds of issues, it's as you said earlier, we've never experienced this before. We've never lived through this kind of thing in our community, in our culture, in our society, and we don't know how to deal with it. And so it should be something we're not afraid to reach out for help. There are lots of people who have never thought of asking for professional help for anxiety or depression or trauma or whatever's going on. And you know, we just want to encourage people to reach out. There are places that you can There are numbers you can call that we'll share as well for getting help finding resources. There are certainly crisis lines, but in the interim, in the middle there are helplines where you can just speak with a mental health professional or get some help with deciding what would be helpful to you.
Are you able to get enough people to help you now? Are there enough volunteers?
Yes, we've staffed up. We have a mental health navigation line, and we did special training at the beginning of this season to equip people to work remotely, taking those calls, which are double the number of calls that we got, average number of calls we got monthly last year. So the calls for help are really, really rising, and almost all mental health professionals are doing telehealth sessions right now so that people can do that virtually from home, and the barriers are so low to getting help, and we just hope people will just reach out and talk to somebody about that, maybe get connected with help.
Has it been a problem in any way that people have not been able to go see their psychologist or therapist in person?
I would say not. I've not heard of any. Andy, you have any?
Yeah, I mean, it's complicated. I mean, I think that the research is pretty clear that actually telehealth, if anything, it works better because, I mean, if you've ever thought about what you would say to somebody's face versus what you would be willing to write into an email, you can see that sometimes you're more willing to be candid in those circumstances. So there's some evidence that it's better and it works easier. So what we found is people who are like used to technology and who are adults, there's been almost no effect. People have dialed in, they're thrilled. What the two groups we've seen a drop off on are folks who are less comfortable with technology. Those might be people who don't have technology, or they may be folks kind of my age or a little older who, you know, we just don't do this stuff. My parents, for example, though my dad has gotten really into Zoom. So I guess, you know, people can still learn. And then families, I think it's been really hard because, I mean, all of our families are now running home schools, you know, that they weren't before, and they're going to be running home childcare, you know, once school's out. And so, you know, I think this is something we often see in summer is that people go to the therapist less, children do, because a lot of times it's too much, it's like too complex. Also, you don't have people who are helping people get to treatment. So a lot of times school officials, you know, teachers, school personnel, they notice, you know, that maybe Andy's having a different experience than Jenny. And so, you know, whereas my parents may not have noticed because that's just how I've always been. So I think that those are some of the barriers we're seeing. But the movement to telehealth, we think is actually a silver lining to this. We hope that that sticks around. We think it's going to be, there's a lot of evidence that shows that this is part of what we need to meet that need that Vanita was talking about earlier, because we know the needs right now are less, but they're going to be increasing.
Well, the thing, you guys talk a lot in your survey, which is a great survey, by the way, about unemployment. And the numbers today look as if there's about 30 million people unemployed. And from what we understand, about 18 million of them have gotten some assistance, but 12 million either haven't applied or haven't gotten assistance. So, Andy, what does this do to, first of all, the anxiety level of people who haven't been able to get through, and to the, if I may apologize for some of the government agencies, they never expected this kind of overwhelming stuff. So what does that do in terms of the anxiety level?
Well, I think Vanita explained this real well a little bit ago, that like these things build. And right now, you know, even in the initial days of when you might lose your job or have something else bad happen, you go into, a lot of people go into action mode. So some people are immediately despondent and at risk, but a lot of folks go into like adrenaline action mode and they overperform and they try to make things work and they keep it going. And then there's a tipping point where it becomes too much. So a lot of us, we can get through a couple weeks of really, really bad things, but the third week or the fourth week, or when plan C doesn't work, and so now we're on to plan D, you know, what we see like with hurricanes, a lot of times what triggers the traumatic response or the person having a really bad situation isn't the hurricane. It's when FEMA for the third time denies their request for help 4 months later. Like that's the tipping point. So all that should say is like, yeah, you know, it was really hard, government, and it was really hard. Nobody expected this. But if someone steps up, whether it's the church, whether it's a family member, whether it's finally that government check, you can do a lot to mitigate that despondency and keep that tipping point on the right side of the equation.
I mentioned this on a previous program, but the Kelton group, I don't know if you've seen their survey, it's very recent. 72% of the people they surveyed said they would reach a breaking point in another 6 weeks. In other words, if this thing continues, even gradually working back in as we're trying to do now, that they would reach a tipping point. And 100% of the people said if it went on for 6 months, that they would be totally overwhelmed with anxiety and obviously some of them with suicidal thoughts. So does that seem to pretty well dovetail with your research?
Well, I mean, I think I would take a little bit of a grain of salt the precision of some of those estimates. I mean, I think that, you know, people generally have a sense of I can take this for now, but not forever. And so I can take it for a while more, like 6 weeks, but I can't take it for 6 months. And I think that's how I would think about it. And, you know, people are pretty resilient. I'm more often surprised by how resilient people are than how fragile they are. But we all have a point at which we can't cope. And so, and we act about in different ways. Like some people become violent. I mean, that's why we're going to be looking at, we're seeing domestic violence rates go up. We're seeing anecdotal evidence of child abuse rates going up. So, I mean, I think there's a lot of things that are going to get worse if we don't get back to some semblance of normal. And I think people know that at an intuitive level. I think to me, the thing I'm most worried about is what Vanita said earlier about how will our nonprofit and other health providers be around in the next 6 to 8 weeks without, because their revenue is down. Even those that have gone to telehealth, a lot of their revenue is down because of the children, because of the older adults. A lot of providers are barely getting through right now.
Yeah. And Vanita, you've obviously dealt with primarily with the suicide issue, but other mental health issues of how people try to self-medicate with drugs of all types, prescription and non-prescription drugs, and also the impact on families as Andy was talking about with domestic violence. So hit on those two subjects for us as well.
Well, we know that all those are increasing. The thing is that mental illness thrives in isolation, and that is what we are living with right now, so much isolation. People may not be alone, but they are alone with their family unit or the people they live with. They're not being out, they're not being social, they're not connecting with other people. All the things that feed mental and emotional health have kind of just been put in the deep freeze right now. And, you know, those numbers we were just talking about of rising rates of despair and depression and other things, if during normal times, the number of people who have symptoms of depression is 1 in 5 Americans, that's just during regular times, and that's kind of been the rate for years, the statistic on that. If it gets worse, which it's certain to do, it just means that we have to be really diligent about helping people learn to connect with help, reach out for help. Isolation is just not a good thing. It's the wrong direction to go. So, you know, we say that the most important things for people to do, families and individuals, is connect. Stay connected with people, take meals to people who can't get out, do anything you can to connect and combat that isolation. Taking care of yourself, recognizing when you're stressed out and you need to take a break and you need to take care of yourself, and then reaching out for help if you need it. Those are all very key things to remember.
Yeah, I think that's right. And Jim, you've got a therapy that you've used fairly successfully. That's with your dogs. I don't want you to give a commercial for your dogs, but you might tell us, you know, sort of the issues that you've been dealing with and how that's worked in your family.
You mean I can't take a video of me in the backyard training my dog? But you know, one of the things that I think has been remarkable about this is going out, taking walks and seeing how families are getting back together, children riding their bikes in the middle of the road. Yesterday, I saw a mother and a child, probably about 8 or 9 years old, running, and you know, it was 9 o'clock in the morning. And I do hope that some of these situations like this that people will be able to talk about, you know, 5, 10 years from now, people will remember it. And I guess to narrow it down to a question, what do you think the impact will be as our parents talk to us about the Great Depression? Do you think our children will have these memories?
I definitely think they will. And I hope that they can look back on them and not look at the bad things that happened as a result during this, but Yesterday, my husband and I went to the house of one of our grandchildren with dry erase markers, and we played with them through the dining room window. We drew pictures. And so along with all the bad that's coming of this, there is opportunity for creative play. And like you, I love seeing people out and about, outside, getting outside. And I just hope that will spread and help to mitigate some of the bad things that may be creating memories among our children.
Of course, I'm afraid that we're going to have an oversurplus and overabundance of squirrels, because I've never seen so many.
Yes.
They're no longer roadkills.
You know, I had a friend the other day whose daughter came up to her 7-year-old and said, "Mom, how did you get through the quarantine when you were little?" And she had to say, "Well, honey, I didn't have this when I was little." And she explained it to her. And I hope too that we have kind of a moment of unity, because when we emerge from this, we will all emerge together from this. And, you know, and we're all going to look at clerks in stores differently. We're going to say, "Hey, you know, you're the people who got us food through this." I mean, you know, we're going to look at people who deliver things to our house with the same, hopefully the same gratitude we do now. We're going to, you know, be a little bit more careful when we leave the house than maybe we otherwise would have. And so I think that the helicopter parent phenomenon you talked about, Vanita, maybe it's the opposite, that we're all going to sort of like be, you know, if we can help each other through this, we're going to have something to be proud of and look back on and say, you know, we helped each other get through this.
But you know, what's different about this too is we can say, what are the defining moments in our life? The Kennedy assassination, we remember that, or 9/11. But this is one situation that everybody in the world has been involved with.
Wrap it up for us, Jim. I think we're just about out of time, and I think Andy and Vanita and Jim's going to put a wrap on it, I think.
Well, I will. I want to thank everybody for joining us. Of course, Dennis, our leader, and want to remind everyone to follow the McCuistion program on Twitter or McCuistionTV.com. And as you know, we are here talking about things that matter with people who care.
For more information, call 214-750-5157 or email Nikki N at nikkimcquistion.com. Visit our website at www.mcquistiontv.com. You can also follow us on Twitter at www.twitter.com/McQuistionTV or download McCuistion TV video podcast on iTunes.